We are just 48 days away from the start of the Tokyo Olympics. This is the latest Japan COVID update on the coronavirus and vaccine situation here in Japan in our series, Japan Coronavirus 2021. Today we will cover the dire situation in Okinawa, the latest on the vaccine rollout here in Japan, and the most recent update on the Tokyo Olympic situation. There's a lot going on here in Japan, so let's just get to it. Hi, I'm Mike Matsuno, the man in Japan. It's early June in the rainy season and the temperatures are starting to climb. I'm really not looking forward to the humid summer that's just over the horizon. If you like this video, please hit that like button. And if you want to know when my next video is coming out, please subscribe. On this channel, I usually talk about daily life in Japan, but recently I've been covering the coronavirus and the vaccine situation here in Japan. Okinawa continues to be in the worst situation of all 47 prefectures in Japan. The Okinawan prefectural government has closed all high schools for 2 weeks. Ishigaki City in Okinawa has also closed elementary and junior high schools. This past week, Okinawa again reached the highest record level of 125 new cases per 100,000 people, which is the figure based on a rolling average of the last 7 days. Okinawa has reached the highest level of stage 4 in all measurement categories. Hospital bed occupancy for coronavirus cases is at 100%, which means there are no available hospital beds for critically ill coronavirus patients in Okinawa. Outside of Okinawa, new coronavirus cases are on the decline nationwide, but available hospital bed space for critically ill coronavirus patients is still very critical. With 48 days left until the Olympics, the vaccine rollout continues steadily in Japan. The latest update from this past week is that 96.9% of medical workers have had one shot. 65.4% had had two. For senior citizens 65 years old and older, 15.4% have had their first shot and only 1.3% have had two shots. 99% of Japan's medical and vaccination facilities believe that they will be able to complete vaccinating the first group of 65 years and older by the end of July. But please note, that is the first group. That only makes up 36 million people out of the entire population of 126 million people in Japan. Presently, there is no shortage of vaccines in Japan. 71 million dosages of Pfizer vaccine are now sitting in Japan. In addition, there is an undisclosed amount of many more millions of dosages that has been sent to Japan from Moderna and AstraZeneca. The requirement of the vaccines is no longer the challenge. It's the implementation of vaccination systems and finding the medical doctors and qualified nurses to give the vaccines, which is the present bottleneck. Over 14 million dosages have been given out up until now. However, there have been several problems with administering the vaccines in different parts of the country. Prime Minister Suga's nationwide goal of 1 million vaccinations a day has not been reached yet. There are presently about 500 to 600,000 injections given daily throughout Japan. The Japanese government is now calling on Japanese companies and universities to offer their facilities to vaccinate their employees and students to help speed up the vaccination rollout starting from June 21st. But the challenge is more than just the facilities and the support of the companies and universities. It is again finding the doctors and nurses who can administer the shots. As you may recall in my past videos, I've talked about Japan's unusual law that stipulates that only medical doctors and qualified nurses are allowed to administer vaccinations. This has caused a huge logjam for Japan. Even if Japan has the stock of vaccines in country, they cannot administer the vaccines quick enough due to the lack of enough doctors and qualified nurses. Just this morning, I talked to my own personal doctor and pharmacist about Japan's late and inefficient vaccine rollout. My doctor said that not having a CDC to set strong medical and safety policy was something that was lacking in Japan, as well as the Japanese government organization structure is usually top-down, not lateral, so there's no communication between lateral agencies and organizations. Last year, my pharmacist and I had this talk about why can't pharmacists be allowed to administer vaccines. Today, I asked him about my idea of having all pharmacists be trained in a one-day session, like in other countries, and then be allowed to administer the coronavirus vaccine. He agreed before and also today that pharmacists should be allowed to administer vaccines and that he would like to be able to administer the vaccine. Also, he added that it was not that difficult a process or skill to administer injections. So again, it's not only me who thinks that things should and could be done very differently. But in Japan, the standing nail gets pounded down and no one wants to make waves. So very few people are very vocal or outspoken when criticizing the government or speaking against the current status quo. Japan continues to lag far behind the other countries in the world. In countries such as Canada and the UK, 58% of their population has received at least one dose of the vaccine, while in Japan it is only 8.7%. As you can see, Japan's position is second to the bottom of this chart. In the US, which has had the highest number of cases in the world, at 30 million cases, 50% of their population has been vaccinated. The US goal is to have 70% of 18 years and older vaccinated by July 4th, which is a very ambitious goal, but you have to hand it to the United States. When they decide to get something done, it happens quite quickly. What made me smile and I thought was so American was seeing the news report where some states in the United States are offering huge cash and prizes to help encourage vaccination. The state of Ohio has a Vax a Million lottery giving away $1 million a week for 5 weeks. Wow, I thought. Sasuga America, which translates into as we would expect, or that is the classic America. Any resident from the state of Ohio who has been vaccinated can qualify to win the $1 million lottery, which in Japan would be unheard of. Also, the news story about in West Virginia, which is a hunting state, they're offering a new hunting rifle to be given away in a lottery if you have been vaccinated. Again, anything like that is beyond the comprehension of most Japanese. There was even the report that if the US hits 70% by July 4th, a major beer company is offering free beer. What more could you ask for to motivate people to get vaccinated, especially the guys? But seriously, the US usually takes second to none when it comes to marketing and quick action. So kudos to the United States, and I'm very happy for Americans to have their lives gradually returning closer to what was once considered normal. As more Japanese see the huge gap of vaccinations and the connection to returning to a more normal life between Japan and other countries on the news, there is more discontent and people are asking the question that I have been asking for the last year. Why was Japan so slow in getting the vaccines and implementing the rollout? Think about it. If you were the country in charge of one of the biggest and the most prestigious events in the world, wouldn't you be extremely proactive, organized, and very quick moving as soon as the decision was made to postpone the Olympics until 2021? Would you not jump on the bandwagon and at Shinkansen, bullet train speed, do everything in your power in the next year to make the country safe and to assure the world that Japan was ready to accept foreign athletes and spectators into the country in the summer of 2021? It could have been a win-win where if done correctly, it could have really gave Japan a strong global brand, just like the 1964 Tokyo Olympics did. Japan could have been noted as forward-thinking, efficient, effective, and an amazing country that other countries would really respect. But now instead, Japan finds itself in basically a no-win situation because of the lack of leadership and vision. There is no one simple answer why Japan did not act sooner with more confidence and leadership. But there are various reasons which I have talked about in earlier videos. I believe that much of this is due to Japan being a very risk-adverse country, very consensus-driven, and they lack any really strong leadership. And as I have said many times in the past, Japan is a reactive country and society, not a proactive one. The coronavirus vaccination rollout has only really started moving faster at the end of this past April 2021, when other countries were already speeding down the highway in their fifth gear. Japan was just beginning to leave their garage in first gear. At the posting of this video, Japan is still planning to move ahead with the Olympics, which starts on July 23rd, 2021. This past week, the new special podium and the new uniforms for the volunteers were unveiled. They also announced that they are setting up antivirus measures for the 878 medal ceremonies that will be taking place. President Hashimoto of the Japan Olympic Organizing Committee said that the hope is that the Olympics will unite the world through the power of sports. There was a news report that 10,000 out of a total of 80,000 Japanese volunteers have decided to quit. The Japan Olympic Organizing Committee gave the reasons that this was due to the concerns of the coronavirus as well as some changes in the working and living environment since the games were postponed from last year to this summer. The Olympic Committee also added that the decline of 10,000 volunteers should not cause any significant problem with operations at both the Olympics and the Paralympics this summer. Meanwhile, this week, Dr. Shigeru Omi, who is the chairman of the Advisory Medical Committee to the Japanese government on the coronavirus, and whose position might be considered to be a rough equivalent in Japan to someone like a Dr. Fauci is in the United States, has been very vocal and has addressed the Japanese Congress twice this week. He said that it is not normal to hold the Olympic Games during a pandemic, and it is very important for the Japanese government and Olympic Planning Committee to offer the public clear reasons to hold the Olympics. Presently, 60% of Japanese believe that the Olympics should be cancelled. And so Dr. Omi added, if Japan is going through with the Olympics, the Japanese government, the Olympic Planning Committee, and officials will have to bear heavy responsibility and must show strong resolve. He continued that the games need to be scaled down as much as possible to prevent the spread of the virus. By the content of his speech and speaking more than once to the Japanese Congress, it seemed to me that Dr. Omi is very concerned that the Japanese government, the Olympic officials, and general public were not taking his message as seriously as he hoped. If you like this video, please hit that like button, and if you want to be updated about what's happening in Japan, please subscribe. As I said in the last video, from my eyes regarding the Olympics, the Japanese government is in a no-win situation. They're damned if they do, and they're damned if they don't. Whatever the Japanese government decides, they will encounter harsh criticism both domestically and from abroad. So keep your fingers crossed that Japan will get through the 2021 Tokyo Olympics safely and without any major incidents or crisis. It'll be all hands on deck and a lot of moving parts that at any time could go off the rails. Ganbatte, Japan. We're counting on you. Thanks for watching this video. Catch you on the backside.